Hello, I want to talk to you about something that is very important to you, your health. All of us want to be healthy and have a good quality of life. And we all know that a proper diet, exercise, and the proper amount of rest contribute to our well-being. But did you know that good health begins in the mouth? That's right. How you care for your teeth and gums has a direct impact on your health. In fact, the Surgeon General's report states that gum disease, also known as periodontal disease, has been linked to numerous life-threatening diseases, including strokes, diabetes, and heart disease. We've all heard of plaque, that sticky film that develops on the surface of our teeth. But what is plaque? Simply put, it's a combination of bacteria and proteins that are in our saliva. And because bacteria are living organisms, they must eat and digest just as we do. But did you know their waste contains toxins that can cause serious problems if left unchecked? Plaque is constantly developing. That's why it's important to brush twice daily and floss at least once a day. This practice will help clean plaque and debris from the surface of your teeth and between them. Unfortunately, we have places in our mouth that are hard to see and difficult to reach. And sometimes we have trouble keeping these areas clean. That's one reason the American Dental Association recommends that you have checkups twice a year. Your dentist can identify and treat problems you are unaware of, including areas under the gums, also called subgingivally. Bacteria are active subgingivally, and since these areas are not visible, they are frequently overlooked. And that's when problems manifest. Have you ever had red sensitive gums, bleeding gums? If so, take note, because these are the signs of first-stage periodontal disease. Surprisingly, periodontal disease affects 75% of Americans, and gum disease is the main cause of tooth loss in adults. It's important to remember that good oral health starts with proper dental hygiene, which in turn helps prevent gum disease and tooth loss. Your teeth are designed to last a lifetime. It's gum disease that causes you to lose your teeth. Most people rely on a toothbrush and dental floss to maintain good oral health, but they only reach about 3 millimeters or 1/8 of an inch under the gums. As such, you are not reaching all the bacteria, and that can lead to periodontal disease. I would like to introduce you to another tool, something that can be used in addition to brushing and flossing. It's the HydroFloss Oral Irrigator. When properly used, the HydroFloss Oral Irrigator will clean your teeth, disrupt plaque and biofilm, and flush bacterial toxins from your mouth. It uses low-pressure irrigation to clean the tooth surface that is under the gum and treat other hard-to-reach areas. The HydroFloss utilizes a patented plaque and tartar-fighting technology to help keep your teeth problem-free. Inside your mouth, you have positive ions on your teeth and negative ions on the bacteria. And just like the positive and negative ends of magnets, these opposites attract. However, by incorporating the science of magnetics with the science of hydrodynamics, the HydroFloss actually interrupts this attraction. How? Inside the handle is a carefully calibrated magnet. When water flows through this magnetic field, millions of free electrons are released and act as a barrier between the positive ions on your teeth and the negative ions on the bacteria. The result? The bacteria does not stick to your teeth. Then the pulsating stream disrupts the biofilm's protective skin and flushes the plaque, the bacteria, and its toxic byproducts away, naturally and painlessly. The HydroFloss Oral Irrigator uses a pulsated water stream with a maximum pressure of 60 psi that has been confirmed to be safe and non-damaging to your gums. And it's the only hydromagnetic oral irrigator that has been clinically tested and proven effective. In fact, clinical studies show that when using ordinary tap water, the HydroFloss is up to 64% more effective in reducing plaque and calculus, also known as tartar, than non-magnetic irrigators. These slides, taken before and just after using the HydroFloss, show its effectiveness in reducing live bacteria. Just imagine how clean and healthy your mouth will be with regular use. Remember, how you care for your teeth directly impacts your overall health. It's important that you brush twice daily, floss at least once a day, and that you continue to have regular checkups. Now, take the next step and ask your dentist or hygienist about the benefits of using a HydroFloss. It's the most effective oral irrigator on the market today. It will leave your mouth clean and your breath fresh. Plus, you'll be healthier. Now that you understand how the HydroFloss works, I want to show you how to use it and the proper way to care for it. Following these simple steps will ensure that you get the maximum benefits from your HydroFloss and years of trouble-free service. Each unit comes with 4 color-coded jet tips, so each family member knows which tip is theirs. To attach a tip, simply remove the existing one from the handle and snap yours in place. Your dentist may recommend that you use a specialty tip with your HydroFloss. These tips and their adapters are available directly from your dentist and can be attached to the handle just like the other ones. The water reservoir, which holds 26 ounces of water, is marked so you can add specific amounts of mouthwash, medicinals, or irrigation solutions directly to it before you add the water. The adjustable pressure regulator switch, located on the front, has 9 settings with a maximum pressure of 60 psi. Although the HydroFloss has been designed and tested to be safe at the maximum setting, we suggest you begin with a lower one and increase it as needed. It's the pulsating stream, 1,200 pulses per minute, that actually creates a vacuum and pulls debris from under the gum. There's a pause flow button on the handle that allows you to irrigate without a mess and to stop the water flow when you readjust the tip inside your mouth. You can use ordinary tap water in your HydroFloss. Just make sure the reservoir is properly seated before using it. If you prefer filling it with water from another container, make sure the reservoir is seated before filling it. Once the unit has been plugged in, use the switch on the front to turn it on and off. For first-time users, set the pressure regulator knob to 5 and gradually increase it until the pulsating stream of water is comfortable to your gums. If you have multiple users in your house, remember to adjust the pressure regulator to your setting before each use. And be sure to use the pause flow button on the handle when not actually irrigating. Using your tip, direct the pulsating stream about 1/4 of an inch from the flat surface of each tooth. Remember, oral irrigation relies on your sense of touch, so you'll be able to determine the proper distance by the feel of the pulsating stream of water. You should be able to irrigate your entire mouth with 1 reservoir of water in less than 2 minutes. That's about half the time it takes to microwave a bag of popcorn. This practice, along with regular visits to your dentist, can significantly improve your oral health and your overall health. Now that you know how to use the HydroFloss, let's review the steps for cleaning it, a practice that will ensure years of trouble-free use. For daily cleaning, simply empty the reservoir and wipe it dry. As you might expect, the weekly cleaning is a little more thorough. First, unplug your HydroFloss. Then remove the reservoir and wash it with warm, soapy water. Lightly clean any buildup that has accumulated where the reservoir nozzle seats into the base unit. Next, clean around the connection end of all jet tips and dry them completely. Now you're ready to flush the HydroFloss, so you'll need to plug it back in. Fill the reservoir with very warm water and set the pressure regulator to the highest level. Without attaching a tip, turn on the unit and empty the reservoir into the sink. To complete the cleaning, flush the unit a second time and then dry it and the reservoir completely. And remember, never submerge the HydroFloss base in water. This can cause serious electrical injury and harm the unit's delicate electronic components. The HydroFloss comes with a 30-day money-back guarantee and is covered by a 1-year warranty. We also offer an additional 2 years of coverage with our extended warranty. Please read the product literature for details about specific warranty limits and our extended protection plan. As you have seen, oral irrigation is an easy and effective way to help care for your teeth and gums. And now that you're familiar with the HydroFloss, we encourage you to use it on a regular basis. We also want to emphasize the importance of brushing and flossing and having dental checkups twice a year. We appreciate the opportunity to bring you this information and hope you found it useful. And remember, good health starts with good dental hygiene.